I'm Dr. Charles from PHI, and today we are discussing how one diet can help improve wound healing in people living with diabetes, while also addressing two of its biggest underlying drivers, high blood sugar and poor metabolic health, including obesity. These are often treated separately, but that explanation is not complete, because in reality, they are connected. They affect the same system, the body's ability to repair and regenerate tissue. When blood sugar remains high over time, it damages blood vessels, reduces circulation, and slows the delivery of oxygen and nutrients to wounds. This delays healing and increases the risk of infection. So the key idea is simple. When you improve your diet, you improve healing from within. The goal is consistency. Consistent eating patterns and consistent food choices. This is the foundation of proper diabetes management and wound healing, blood sugar control and healing. High blood sugar is one of the biggest barriers to wound healing, so reduce or avoid sugary drinks and excess refined carbohydrates like white bread, biscuits, and instant noodles. Avoid large, irregular meals and replace with balanced meals featuring carbohydrates, protein, and healthy fats. Use whole grains instead of refined grains and maintain regular meal timing. Because the pattern is high blood sugar leads to damaged blood vessels and poor wound healing. Stable blood sugar leads to improved circulation and better healing. Protein and tissue repair. Protein is essential for rebuilding damaged tissue. Without enough protein, wounds take longer to close. Focus on fish, eggs, lean meat, beans, and legumes. Protein supports tissue regeneration, immune function, and muscle maintenance, and that directly improves wound healing outcomes. Hydration and circulation. Water plays a critical role in healing. Dehydration slows circulation and reduces nutrient delivery to wounds. So aim for regular water intake throughout the day. Reduce sugary drinks and excess caffeinated beverages, because good hydration leads to better blood flow and improved nutrient delivery to tissues. Key nutrients for healing. Certain vitamins and minerals are especially important in wound healing. Focus on foods rich in vitamin C, like oranges and pawpaw, zinc found in beans, nuts, and seeds, and vitamin A from carrots and leafy greens. These nutrients help strengthen the immune system, support skin repair, and reduce inflammation, weight, and metabolic health. Excess body weight increases inflammation and slows healing. So the goal is not extreme dieting, it is structured, balanced eating. Focus on portion control, whole foods, and regular meal patterns. Because better metabolic health leads to reduced inflammation and faster healing. Step back and look at the system. When you step back, the pattern becomes clear. Control blood sugar, increase protein intake, stay hydrated, improve nutrient quality, and support healthy weight. And when you do this consistently, you are not just eating healthy, you are actively supporting tissue repair and improving circulation. You are reducing infection risk and speeding up wound healing. This is the foundation of nutrition in diabetic wound care. When to act. If you have diabetes, slow healing wounds, or notice frequent infections, early action matters. Do not wait for small wounds to become serious complications. Speak to your healthcare provider for proper assessment and guidance, or call or WhatsApp +233 2800 and 720 347.